100,000 deaths and 2 million confirmed cases, coronavirus have become the enemy and a vision for every country to take action against it. It has already changed our daily lifestyles, and yet the cases rise day by day.
My government decided to impose a movement control order.
Malaysia has announced a 2-week nationwide lockdown.
I'm officially declaring a national emergency.
First, we will close most workplaces.
So what is coronavirus? Coronavirus is also known as COVID-19. It is a highly infectious disease caused by a new virus. It is known to be in a large family of viruses which may cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome (MERS) and Severe Acute Respiratory Syndrome (SARS). The most recently discovered coronavirus causes coronavirus disease, COVID-19. COVID-19 is closely related to Severe Acute Respiratory Syndrome (SARS), which swept around the world in 2002 to 2003. The virus is also known to be a combination of SARS and HIV. So how did all of this begin? It was first discovered by a doctor named Dr. Li Wenliang, an ophthalmologist, posted in his story on Weibo. From a hospital bed a month after sending out his initial warning, he had noticed 7 cases of a virus that he thought looked like SARS, the virus that led to a global epidemic in 2003. On 30th December, he sent a message to his fellow doctors in a chat group warning them to wear protective clothing to avoid infection. However, 4 days later, he was summoned to the Public Security Bureau where he was told to sign a letter as he was accused of making false comments that had severely disturbed the social order. The case was later placed aside and ignored as the Public Security Bureau claimed that it was a false accusation. No doctors wore protective clothing to avoid the infection, as Dr. Li Wenliang had apologized to the public. The case was taken lightly and nobody saw it coming. The first human cases of COVID-19 were identified in Wuhan City, China in December 2019. The source of the coronavirus is believed to be a wet market in Wuhan which sold both dead and live animals including fish and birds. Such markets pose a heightened risk of viruses jumping from animals to humans because hygiene standards are difficult to maintain if live animals are being kept and butchered on site. Typically, they are also densely packed, allowing disease to spread from species to another species. The animal source of COVID-19 has not yet been identified, but the original host is thought to be bats, as in 2003 the SARS found the source came from bats. Since coronavirus is closely related to SARS, so they suspected that it might be bats. News went crazy when they heard that there was an entertainer or a TV show showed that a person ate a bat that is served on the dish in a restaurant in China. Bats were not sold at the Wuhan market, but may have infected live chickens or other animals sold there. However, there are some people or some news that claim that there are bats being sold in Wuhan market. Since China is a closed media country, most of their social media and government officials are heavily involved to avoid propaganda. Weibo is one of the famous social media that is created in China for the citizens to use it. There are many famous social media platforms are banned in China, such as Instagram, Twitter, Facebook are all blocked in China for your information. This is because the government itself wants to be heavily involved in controlling the social media on what news that should be posted outside there and what news that shouldn't be posted. Therefore, Dr. Li's message was not able to reach out to many of us. However, it was then leaked online. In his Weibo post, he describes on January 10, he started coughing continuously. The next day, he had a fever, and 2 days later, he was in the hospital. He was diagnosed with the coronavirus on 30th of January. During the outbreak, the local authorities apologized to Dr. Lee. However, sadly, Dr. Lee passed away due to his weakening condition by the coronavirus on Friday morning, 7th of February. Before his death, when he was in a critical condition, citizens of China can be heard shouting his name across the apartment in showing support towards him fighting the virus itself. What are the symptoms of coronavirus? According to the World Health Organization, the most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients may have aches and pains, nasal congestions, runny nose, sore throat, or diarrhea. These symptoms are usually mild and begin gradually. Some people become infected, but they don't develop any symptoms and they don't even feel unwell, and it's just like any normal days without any feeling of uneasy. And this is why coronavirus is hard to be detected and you have to quarantine yourself for 14 days. If you discover you have any of these symptoms that has been there for a long term, seek for medical attention, as you might never know it might grow worse. Most people recover from the disease without needing any special treatment. Around 1 out of every 6 people who gets COVID-19 becomes seriously ill and develops difficulty breathing. Older people and those with underlying medical problems like high blood pressure, heart problems, or diabetes are more likely to develop serious illness. Our lifestyle is heavily affected by the virus, as we have to take extra safety precautions when heading out of our house, such as wearing a face mask is a must to prevent the spreading of the virus. Many countries have implemented large and most restrictive mass quarantines, such as China, Denmark, El Salvador, France, Malaysia, Italy, New Zealand, Poland, and Spain. However, in Malaysia, we are lucky to still be able to head out and buy our daily needs, as our government has only implemented a movement control order. However, citizens are panic buying, and due to the situation which causes lack of resources, false news were also being spread around, but luckily Malaysian government were able to handle it very well. Sadly, there are still many citizens that fail to obey the regulations. Global economy is in a depression and it will take a long time to recover from the loss. In India, the police are seen to be carrying a stick to beat citizens who disobey the movement control order. In America, President Trump has only advised citizens to stay at home, but have no plans to implement movement control or quarantine, as he say it is unnecessary, but the death toll rises by hundreds daily. Just only on 6th of April, President Trump sounded the alarm as the amount of cases have risen to 336,673 confirmed cases and 9,616 deaths, and it is still climbing ahead. And according to the graph, America now has the most infected amount of cases and the most amount of deaths. In North Korea, it is unknown as their first infected patient was shot and killed. South Korea have issued a movement control order. However, the Shincheonji Church of Jesus failed to cooperate in containing the spread of the virus, and sadly, because of this case, the number of cases in South Korea begins to climb quickly on February 27. The officials of South Korea have filed a legal complaint to prosecutors against 12 leaders of the sect, including its founder Lee Man-hee. In Italy, there are 128,000 of cases and 15,000 deaths, making it one of the highest death rates in the world. Well, it was, but now America has took over. The latest update on April 17 here was approximately over 2 million in the world confirmed with the virus and about 146,000 deaths, which feared everyone globally, and the number continues to rise daily. However, it is considered under control. On the bright side, environmental pollution rate has dropped drastically, which allows flora and fauna for the time being to increase their habitat area and with no fear of humans' continuous pollution. What sparks my curiosity was a weird fact that was spread everywhere in social media. There was a post stating that there is a pandemic every 100 years. In 1720, the Great Plague of Marseille was discovered and roughly 100,000 people died of the disease. Plague walls were even built to try and contain the infection, but it still spilled over into southern France before finally disappearing in 1722. In 1820, the cholera pandemic in Asia occurred, killing roughly 100,000 people. Among the affected countries are such as Indonesia, Thailand, and the Philippines. And this pandemic has killed about the same number of people too. Moving on to another 100 years, the Spanish flu occurred in 1920. Spanish flu associated with H1N1 has about 500 million confirmed cases and 50 million deaths, making it one of the deadliest diseases on the list in history. And last but not least, the present 2020 coronavirus outbreak. Although health experts claim that this is a false myth, however, we can all say that we have another 100 years to go to confirm if this is a myth or is it not.